Hi everyone, Dr. Omid Termechi here again, and we are continuing on our series of um, short videos on how to work with a Blue Sky Planner and how to treatment plan your patients on their program, as well as being able to just generally diagnose and treatment plan your patients for in your office, just reading a CBCT and converting it into some sort of planner. This just happened to be a free software, so you could always download it directly from their website, blueskybio.com, and it actually works on Mac as well as a PC. So I made two videos before this, so this is the third one. I just wanted to tell you, in case you have missed them, you're more than welcome to go to our YouTube channel, Dental Implant Surgical Seminar, and subscribe there, and you will find the videos. And I also have different videos of surgeries and prosthetics and whatnot, and you might find some of these videos useful as well. So don't hesitate to subscribe and just put a marker so you could get an alert when I post something and you could watch them. So just continuing on where we were at until now, we brought the DICOM image into the planner. We stitched the STL file to the DICOM image, to the CBCT, and now I want to go over what it is that you are actually looking at. So this is your window. You have, and you could alter it to whatever it is that you want in order for you to be comfortable. But what I like to see personally, on the upper left side, I have a cross-sectional views. On a lower, let me just get rid of this. In the front of me, I have axial view. On the bottom left, you have a 3D image. On the bottom right, you have a panoramic. And then this image on the upper right side is a tangential. And now I'm going to describe to you exactly what it is that you are looking at in any of these, and how you should be able to read these images and know exactly where you are at each moment that you're looking at this view right now. What is this view and where it is in the patient's mouth? You should be able to know exactly what you're looking at, which area of the mouth you're looking at. So let's just start from here. Take a look at the panoramic view. There's a button over here where it gives you all the slices and all the dimensions on your CBCT. You could turn it off, they all go away, or you could turn it back on. Okay. The first thing I do, generally speaking, the program try to map your jaw, and by mapping it means that you could take a look and see these slices. You could see these outlines running on your jaw, and it's trying to go ahead and do the best it can do in order for you to be able to see all the slices properly. Now you could see part of the jaw here is out of line, so you have three lines here, two yellows and one, it's kind of like an off-white, and this off-white is, you can go ahead and change it by simply changing your panoramic view. So what does this really mean? When you're looking at this image right now and you have two yellow lines and the middle section is off white line, it means that right now when you're looking at your panoramic view, everything that you have here, it's running from this yellow line up to this yellow line. That means even on your panoramic view, you are missing some data, which means this area of the bone you are not seeing, this area of the bone you are not seeing. In order to bring the entire jawbone into the image, I suggest, and I'll tell you, you can take this and expand it. And all of a sudden you could see there's a change, especially in your tangential view. I usually open this up as big as I possibly can because I want to have more information in here. Okay, now this also, right now the computer has mapped my jawbone not exactly the way I wanted to have it. So in order for me to go ahead and map my jawbone, I make sure that you see this blue line. I try to put this blue line fairly in the midsection of the mandible. Okay, this blue line corresponds to your axial image. You see these numbers that are blue color? That's corresponding to this line. That means right now on the axial image you're looking at that particular slice right there. You put it over here, your axial image right now is giving you 1 millimeter of slice through the mandible in this position. Bring it up here. Now you could see, you only see teeth, you don't see much of a bone. You see a little bit of a bone over here in the retromolar pad area, but you're seeing the teeth. So now you can understand exactly what this axial image, how it's responding to what you're doing on your panoramic image. Now I want to take this panoramic image right now. It's a true panoramic image, which means that all the slices of a CBCT on a panoramic view has been superimposed on top of each other. So you're looking at a true panoramic image in this area. Okay, so this is a true panoramic that you generally do with any digital panoramic viewer, and you can go ahead and this is what you're looking at. Now, in order for you to look at this image as a CBCT, there's a button over here that you click, and all of a sudden your panoramic view changes to a CBCT 1 millimeter slice through your bone. Okay, now where is this slice? What am I looking? Where is it located exactly? In order for you to know exactly how this slice, where it's located, now you're going to come over here in the axial image. And on the axial image, now you could see before we had the yellow line going on each side of the bone. Now the yellow line is running fairly in the middle of your mandible. This yellow line corresponds to this panoramic image. Now, in order to know if this is a reality, take a look. I will take, and the yellow line will give you square sections on it, as well, I'm going to get rid of this for, oh, sorry, as well as one circle at the very tip of this yellow indicator. If you take the yellow, if you take this, the round, and you move it up and down, you actually move the entire section up and down as it's shaped the way it is. And you could see as you're moving up and down, your images changes. Okay, so if I move it over here, I'm seeing more of the teeth. If I move it back here, I'm seeing more of the bone. Okay, put it over here, I see teeth and bone. Okay, so what I do is I basically keep the yellow, the blue in midsection of the mandible, okay, as much as possible. And then I can just kind of move around these boxes. And you could see on a panoramic image, as you're doing this, you could see the images are kind of changing a little bit because the slices start running a little differently. Now you could see I have a much better image of my mandible as we are looking at it. Okay, so now that you have mapped basically your mandible properly, and if this image, if this CBCT, if this program right now, you have a maxilla as well as a mandible, I would suggest you first do whatever you need to do in one arch by mapping it properly for that particular arch. So maxilla, obviously the shape of a maxilla is different, so you have to map maxilla separately. You do what you need to do, you treatment plan, you do everything that you have to do, and then you move down to mandible, and then you map the mandible. It's just simply easier to go ahead and do that and start treatment planning your patients that way. It makes it much easier. So going back into our windows in these areas and what we're looking at, the other thing that I wanted to mention to you is when you're looking at your panoramic view, you have these three lines. It's a red, yellow, and a purple color. And these red, yellow, and purple color just corresponding to these cross sectionals, which is red, yellow, and you can look at the numbers, and a purple. Okay? So a blue corresponds to this line on a panoramic view. That gives you an axial image. And these three give you your cross-sectional. Now, you can change your viewing by basically going here and changing your viewing to 5 images instead of 3. I like to keep 3 only because I can see them larger and it's much easier for me. But just to give you an understanding, take a look over here and see what just happened. I changed this to a 5 viewing image of cross section, and all of a sudden we have 5 lines in this area corresponding to this. Okay, so I like to go ahead and go back to my 3 because I can see each one, and then you could always go ahead and scroll down between the images if you need to go ahead and take a look at it, but I think the 3 is good enough. If you want to enhance your image, or if you want to see much bigger, you can always go ahead and get rid of one window, make the other one larger. You're not completely getting rid of it, but you're able to go ahead and basically make everything bigger. And the way I make these larger is basically, as I said in the past videos, use a mouse, right click, closer to you, gets smaller, away from you, gets larger. You want to move the image, you click on the scroll in the middle of your mouse, and then you could actually physically move the window. You want to move each one, you have to be in that particular window, and that's how you could go ahead and move it. The last image that is what I wanted to show you is our tangential. Okay, and the tangential is this green stick that you see on the axial image corresponding to this green. So if you kind of get confused of these colors, what do they correspond, this is how you can go ahead and indicate yourself and just make yourself understand where you're at. If I take this tangential and I basically, you can rotate around in a 360 degrees around where you, on the axis of whatever you're looking at. Now this comes handy when you have an implant in here, where we're gonna soon place implants and figure that out, but it will allow you to go around the implant and be able to go ahead and see exactly where you are at and whether you're in bone, hitting a tooth. And a lot of times when you are treatment planning, as far as angulation and things like that, I use this tangential view to be able to go ahead and do that. And of course, this is your 3D image that you can go ahead and take a look. The way you move it is left click and rotate, okay, up and down. You want to make it larger, right click away from you, or right click towards you, get smaller. So that's how you could go ahead and take a look. So now we have all these windows. I'm looking at this image right now. I can tell without moving what I'm looking at. I'm looking at this axial image right now in this area, midsection of the mandible. I'm looking at the area that I would say maybe number 22 area. This probably is number 22, 23 area, as you could see in these lines. And the tangential, I can take a look over here and say, okay, I know exactly where this tangential is, okay? And of course, your 3D is just your 3D. So this is how you are basically reading this. I want to come back and we will start placing our implant. Thank you very much for watching, and see you next time.